Girbeagly!
Hey there guys and gals, it's Girbeagly with another episode of Gaming with Girbeagly, and I'm once again playing another random one-shot. This is from over on SurgerySquad.com. Now, Surgery Squad was recommended to me by one of you after I played the Operate Now surgery games. Apparently, this is the much less cartoony version of those games, and this is more for educational purposes than for actual gameplay. So the gameplay's a little bit lessened, and the focus is more on sort of like the graphic details of each surgery. This surgery may contain graphic procedures inappropriate for children or squeamish adults, is what it says right there. I'm not really the most squeamish person. Obviously, you guys know I hate needles beyond words, but beyond that, I can handle most things. But that's your warning right there. If you guys want to turn the video off, turn it off now because things are about to get pretty funky. So... And this is, I believe this website's run by actual doctors, which is really cool.
Welcome to Surgery Squad's virtual root canal
So we're doing a root canal, which is, you know, everyone's favorite. Hi there, Dr. Jeff.
With this surgery today.
He's our virtual surgeon.
A root canal is an endodontic dental procedure that's used to repair and save a decayed or infected tooth.
Oh.
During a root canal, your dentist or endodontist will remove the pulp tissue within the tooth.
That sounds
Once
delicious.
Everything is removed, they'll clean out any contaminants inside the tooth and seal it to prevent any further infection.
Ah. Good.
Our patient today is having a root
He's
canal
very handsome.
performed on their lower right second premolar.
Oh.
A dental professional may refer to this tooth as tooth 29.
Tooth 29. Let's go get him.
Begin,
Number 29.
to review some of the common
Touchdown.
myths
Field
and
goal.
misconceptions
Goal.
surrounding root canal
Something.
treatment.
Sports terms. Myth conceptions. I see what you did there. That's a great pun, Dr. Jeff. Would you like to review some of the common myths and misconceptions surrounding... No. I honestly have no interest at all, Dr. Jeff. I just want to do the surgery. I'm a professional.
As comfortable as possible, we need to inject a local anesthetic into
Oh,
the
God.
bone line. But first, apply a topical numbing gel to the injection
Okay, yeah,
site.
let's just only
This will
use
help
numbing
reduce
gel.
Any discomfort the needle may cause.
Yes. Oh, God, we have to use the needle. Can't we just use this? Can't we swab
Next,
the
we can inject
stuff
the
on?
local anesthetic. After the local anesthetic has taken
I don't want to do
effect,
that.
the area should become numb for a few hours.
Dr. Jeff, I don't want to
Use
do
the
that.
syringe to inject the local anesthetic into the patient's gums.
Oh.
Just below the tooth, we'll be performing a root canal treatment on.
I like how the tongue, like, pulsates. Oh, my God, this is a huge fucking needle, dude. Are you sure we need this? I know you're a doctor, but this looks huge. I'm not a huge fan of the dentist, to be honest. I get really freaked out because they use a ton of needles, and it hurts. It's not, oh, God, it's not, oh.
Let's give our patient a few minutes to relax.
Yeah, please. That was a big needle. He needs a lot of time to relax. That was only 5 minutes, you cruel bastard. You freak. You jerk. But anyway, like I was saying...
Now that the patient's mouth is numb, we can move on to isolating the tooth.
Oh, good.
Since our patient's
let's do
saliva
that.
contains contaminants that we don't want getting into the tooth, isolation is a critical step during root canal treatment. To isolate the tooth, we need to punch a small hole into the rubber dental dam and place it over the tooth.
Okay. All right. So, like I was saying, though, dentists, like, I don't like them just do the fact... Like, I like dentists. They're nice people, normally, but I don't like going to the dentist because a lot of the time, you know, just bad things happen. Bad things being, like, I have to, you know, get my teeth drilled or something because I have a cavity.
Once
I
the
hate
rubber
that.
dam is in
It's
place,
the worst.
put on
Because
a
it means
tooth
needles.
to keep it from moving.
Okay, I can do that. Torture device, this medieval torture device that we're putting on his tooth when he asks for help.
As much as possible, using our air-water syringe.
Okay, I guess I can do that. I'm okay with air-water syringe because it's not a real syringe. Oh, yeah, spray that good. Yeah,
So far,
get that.
so good. Now
So
that
far,
the
so
tooth
good?
has been
Thanks,
isolated,
Dr. Jeff.
We can create our access cavity in the tooth using our drill.
Oh, God. Okay, here's where things get dicey. We're going to be drilling. Ooh, right into there. Ooh, get in that tooth. Oh, no. That's a terrible noise. I hate that.
The next step is to clean and shape the tooth's canal using a root canal file.
Oh,
Go
God.
ahead and give it a shot.
Oh, it's like a big needle. That's the worst. Oh, and we just shove it in there? We're just going to shove this in there. Now, for those of you who have ever gotten your teeth drilled before, that is, like, one of the worst sensations. It's so weird. Oh, man, you're just jamming it in there. That is violent. Stop.
At this point, the dentist would measure the depth of the canal using a combination of x-rays and specialized equipment.
Yeah.
If a dentist fails to measure properly, it could mean that the tooth would be at risk for reinfection.
Oh.
Now
well,
we
don't
need to
fuck up
clean
your
the
job
canal
then,
of the
dentist.
tooth using sodium hypochlorite, commonly known as bleach.
Oh, yeah, let's go ahead and just load this with bleach. That's just what we always wanted to do. Oh, yucky.
We'll let the bleach sit in our patient's tooth for about 5 minutes.
Sounds about
Make
right.
sure that all the bacteria and tissue inside the tooth has been dissolved.
Can we get that cool 5-minute interlude? There it is, the 5-minute interlude screen.
Great. Now
yeah.
use the suction to remove the bleach from the patient's tooth.
Okay, you know, this one isn't as bad as I thought it was gonna be. I guess I didn't know that much about root canals, but now that I do,
Next,
I'm so educated.
We need to fill the tooth using a rubber compound known as gutta percha.
Okay.
Gutta percha is often preformed as tiny, thin cones that we'll insert into the clean canal of the tooth.
I mean, this does not look pleasant, though.
I've already added some sealant to the gutta percha cone. Let's see what you can do.
Can you just shut the hell up, Dr. Jeff? I'm doing my job here. Like, I mean, look how deep this goes. I mean, it is the tooth. That's the root of the tooth. So that's, like, way in his gum. So when you do think about it, that is pretty goddamn nasty and yucky, and I don't like it. Oh, yeah, just...
Looking good.
That looks great. Let's leave it that way and seal her up.
To remove the excess gutta percha.
Okay. Well, let's do that, I guess. Wow, that's hardcore.
Into the tooth canal using a plugger.
Okay, I can do that as well. Let's plug it up. Yeah, rub that. That is... Oh, we just squish it in there like that?
After the gutta percha has been placed,
Hi,
it is common
stock
that
photo.
additional x-rays are taken to verify that the canal has been adequately sealed off.
Wonderful.
Once
Good.
the dentist verifies that the canal has been sealed, a filling or crown is placed, depending on the location of the tooth.
Okay.
You can learn more about fillings and crowns in our virtual dental filling and virtual dental crown procedures
Neat.
here on SurgerySquad.com.
Right here on SurgerySquad.com.
After a root canal, patients should expect some mild sensitivity and discomfort.
I can imagine.
This can usually be relieved using over-the-counter pain medication.
Yes,
such as
lots of it.
ibuprofen or naproxen.
Let's get
By
our patient
brushing
super
twice a
high.
day, flossing daily, scheduling regular dental visits, and avoiding smoking.
Okay.
It is possible to greatly reduce the need for a root canal.
Okay, well, thanks, Dr.
And
Jeff.
that's a root canal.
And that's
Why
a root
not
canal.
Check out some of our other amazing surgeries.
Amazing
here on
surgeries.
SurgerySquad.com.
Thank you, Dr. Jeff. That was a wonderful, wonderful tour of that. So that actually wasn't as bad as I thought it was going to be. I know that some of them are really funky, but I wanted to start off with one that, like, you know, kind of squeamed me out, which is anything in the mouth. Like I said, it's weird because, like, I'll watch a horror movie and, like, someone's jaw will get ripped off or something, and I'll be like, whatever, their teeth will get knocked out. But when it happens to me, not when it happens to me, I've never had my jaw ripped off, but when I go to the dentist, like I was saying, it always, you know, gets me a little bit uncomfortable to have them poking around in there with needles and whatnot. Ugh, I don't like that. But maybe next time we'll find one that's a little bit more, I don't know, nightmare-inducing. If you guys enjoyed this one, though, please be sure to hit that like button, share the video, and favorite it. Also, be sure to subscribe to me if you guys haven't already. For those of you who have, thank you so much for all of your support. You guys are the best in the world. I love every single one of you, and as always, it was great seeing ya. Bye-bye. Otherwise, I'm liable to end up with a concussion. I emphasize the point by rubbing at the back of my head. Emmy giggles madly.
You could wear a helmet. Some kids here do, you know.
Or I could just take revenge. Whoa! I love that expression on her face. I grab a pillow from beside me and whack Emmy over the head. Whoa! Oh, she died.